This is Moshe Frank for COLLive.com, streaming from the Levium Jewish Art Gallery. And today we have the honor and pleasure of having Dr. Harvey Lang.
Tzvi Lang. Dr. Tzvi Lang, or Harvey Lang, okay, whatever you want.
Who's not only a doctor, you're a chiropractor, right? Doctor?
I'm a chiropractor kinesiologist.
And also a former leader of Barakol, right?
Yes.
Former leader of the Community Council. So, Dr. Lang, in the past we had two MDs, perspective on Corona, and we had perspective from a more natural perspective. So here we are. Doctor, what do we do about Corona? And I guess from a health perspective, more prevention, right?
Well, yeah, I think the big problem, and that I've been hearing from experts is underlying conditions such as diabetes type 2, and the problem is a lot of overweight people have it and they don't realize it. They're called borderline, or there's certain blood tests that help, like fasting. Insulin levels are much better to check, and that has to be watched with people have to be very, very careful of the amount of carbohydrate intake they have, and they have to lower their insulin levels where they won't have to even take additional insulin, and their body will have more than enough, and they should keep to a low carb, even a ketogenic diet as much as possible, and that will take care of a lot of type 2 diabetics and improve their situation. And that seems to be a big grabber of the coronavirus, lo aleinu, and I know myself, if I didn't make changes in my own life and diet and stuff like that, I think I would have had a much worse attack than I had. And so you see that with a lot of people with the big bellies, but you also see with a lot of thin people that have hidden diabetes that they either know about it or that they don't know about it. And I think that's one of the biggest problems, so besides leading to other problems. But that's a big thing, and people should ask their local physician to order fasting insulin levels as one of the main things. And there's even a fancier test they could test it's called the Kraft test, but that's more sophisticated. But at least get fasting insulin levels, and that's what I recommend to all my patients now.
Do you mind moving your finger a little to the camera?
Am I blocking everybody? Am I?
No.
Can you think? Am I good?
Almost. No, you see your finger? Look at the screen. You see your finger?
I don't see my finger.
Oh, now it's perfect. Good. So you're saying a lot of the people that are dying or very sick are people who have borderline diabetes, or they don't even know they have diabetes.
Yeah, it's called borderline because they're looking at fasting, glucose of 100, 105 underneath what the official name for diabetes is. But I think a better way to check it is look for insulin levels, and it's a more sophisticated test, and whatever the levels could be remedied by a very low carb diets, and that's what most of us should be on right now, because there's no real function for carbohydrates. And I even spoke to Rabbi Yazdu, it was my personal thing that if they should you can minimize even eating carbs on the Sabbath as much as possible, as much as you need to. In my case, I really needed to. So that's.
At what age do you suggest people take this diabetes test, especially now with Corona? Are you suggesting they take it?
It's one of the things that cause inflammation, but it's something that if you work very intensely on, in a couple of weeks, you can see at least some results. And that's immediately to go off carbohydrates as much as possible. That means even fruit and sugar and breads as much as possible, and stick to eating fat and meat and chicken, or even they're vegetarians that are successfully doing this even. So it's you can do it from any perspective you like to live your life, but the idea is to cut off the carbohydrates as much as possible.
So any person that is concerned should definitely cut out carbs now to help them deal with.
Yeah, especially overweight people, fat people, people with known metabolic syndrome, with which is there's a high blood pressure, high sugar levels, it's high insulin levels. It's all one big fat syndrome, and even not only on the fat people, but it's also for skinny people. And the older you are, the more you have to worry about it. And if people are in that older class, especially, and with the bellies, they should immediately try to do something by immediately lower their. But I really think that most people in Crown Heights have had it or have it already, and I think there's very few people that didn't, in Crown Heights at least, which is the population I see a lot, has had the corona already. So it should be going out to the rest of the world, that people that in other places besides Brooklyn and Crown Heights, maybe someplace in Missouri where they live in a small town and they're still trying to shield themselves from it. Have to watch these same things, and the big thing. The big experts say that that people, at least on a short term, should be taking zinc and high doses of vitamin C, and if they're sick, God forbid, with it, they should be taking, if possible, IV vitamin C, which is even better. And D3 is very good for your immune system too. D3. So that's the so-called natural perspective, but not that all natural things are good. And arsenic is a natural thing too. I mean, and antibiotics save lives. And so I'm not one of these guys that are against non-natural things and favor all natural things. It doesn't work like that, and you got to be insane to be like that.
What's your opinion about Dr. Zev Zelenko from Orange County with his what's it called? I don't know. Hydro something?
Chloroquine. Well, we don't have any, something that seems to work by so many people and so many reports. It has to be tried. And I'm really believing in after we get reports, they're not double-blind, placebo-controlled studies, but there are a couple of people that have some heart problems that they have to be careful and maybe only take it under the supervision of a cardiologist, that have a couple of arrhythmias that have to be careful. But usually it's not that much damage that it does, and if they take it with somebody who's an internist or even better, a cardiologist, they should be able to do it and watch closely.
Why is it that the whatever it's called, I'm still can't pronounce it.
Hydrochloroquine. Yeah, there's a couple of different variations of it. It's like quinine. As a matter of fact, it's an anti-malaria drug like quinine, and quinine is, by the way, selling off the shelves, I understand. Like gin and tonic type drinks, tonic waters, quinine. And I had that, and it's grabbed, and I heard it's very hard to even buy that. And I don't understand why the governor made the chloroquine not available in the state. I don't understand, but I think he's rescinding that. And it's very important that people take zinc. The zinc is very, very important, especially for some of the minor loss of smells symptoms of the virus. People lose their smell, sense of taste, and the zinc is excellent in restoring that. And the zinc is a very, very good antiviral. It works very good with the chloroquine combination. And I don't understand exactly how an anti-malarial works with it, but whatever it is, we have enough independent people that say it's worth a try, and to wait till the studies come in is insanity when we have an epidemic of very sick people.
Oh, how does zinc affect to get your taste and smell back?
Well, zinc itself is an antiviral, and I just know it works, and I don't know all the biochemistry of how it works, but it works, and it's known by lots of people. It's been reported by lots of doctors that it works for that. So I don't know I don't know all the biochemical analysis of any of it.
Okay, so if I could summarize the takeaway from your advice is number one, do add add vitamin C, and if you're older or fatter, you should definitely test for diabetes, because many people dying or getting sick now are borderline diabetes people who don't know they have it. Correct?
They really have it, but it's defined in a different way. Fasting insulin levels, whatever, there has to be a certain level down, and the lab will tell you it's not an easy test to take, like blood sugar, but it's something that's very, very necessary, and I think that everybody should include that in any time they see their physicians or anybody who orders tests. I order it on my patients. I've started to order it, and it's not just an easy test to take, but it should be included, and probably more expensive if you're not covered for it. But it's worth whatever it costs, because all that stuff besides leading to a susceptibility to the coronavirus, it leads to problems in heart, and it leads to problems with what they actually call, some of the doctors call it type 3 diabetes, which is really like Alzheimer problems, and in the brain is a whole series of things. And if you keep your carbs down and your insulin levels low, you'll be preventing and even maybe curing a lot of things. We recommend also people take as far as for the heart, because it is related to the heart. It's called the CAC test, which is the calcium score in the heart. There's not too many places that offer it in Brooklyn, because you need a lot. It's not a high paying thing, but there are places in Queens and New Jersey to get it. But that's another thing too.
So how many different diabetes testing? There's a blood sugar. Would you say before?
I do. Well, there's blood sugar. There's this typical taking blood sugar, fasting blood sugars, but it's not. It doesn't bring you the same information, in my opinion, and a lot of other people's opinion, a lot of the other doctors, as taking a fasting insulin instead of taking fasting and checking your. Now, if somebody has diabetes, it's a very good thing to have these monitors. There's a lot of little points that I can give you, because I manage patients that happen to have diabetes, and we're successful, and people going on this diet, and it's a diet for life. It's really a diet for life, because once you start taking a lot of carbs, whatever you're stuck with this for life, and almost everybody's stuck with this, because very few people nowadays can handle the high carbs and sugars, and even from fruit. So very few little fruit that we eat. I'll have some berries. Some berries are good. They're low in carbs. There's a lot of tips I can give people along the way about this, because I've been delving into this for the last year or two. There's intermittent fasting that helps tremendously. It's a whole thing about keto, low carb diets, and keto, and that will, besides make people lose weight, which is looks good, but they will also lose a lot of that insulin spiking, and that's what the nature of type 2 diabetes is.
How do you feel full if you're not having carbs? Is it much harder?
Something fats and proteins are very satiating for a lot of people, and you have to transition. It takes a few days to get used to it, but once you do it, I mean, we have very low carbs. My wife and I consume less than 20 carbohydrate grams a day, and we do fine on it, and I get stuffed, and and thank God we're affluent. Most of us, we can afford good fatty meats, especially meats that are grass-fed. That's even another tweak, but that's what we got to do, and we do the best we can. And within a week, people get used to it, and they feel full. Bread is just bread, and carbs are completely has almost no uses nutritionally. There's nothing good it really does. So you're changing to a body that burns fat, and there's great things like good olive oil and great things you can be taking, and there's a fruit called avocado that everybody takes during Pesach, and certain nuts are good, except for cashew maybe.
Okay.
That's what it is.
Is someone who's doesn't have that amount of money to have meat and steak for breakfast, lunch, and dinner, is there a cheaper option or not really?
First of all, you don't need breakfast, lunch, and dinner. You can skip a meal here and there, number one. Number two, eggs are great. Eggs are great. The better the eggs, my eggs, we have eggs as a big staple. People eat milk, eggs, cheese, low-carb cheese, butter. These are great things. There's great things. Fat is the main thing. We want to actually live on fat, secondarily on protein. And you don't have to be so wealthy to buy a little piece of chicken at night or something. It's not fish. Fish is actually very good. Good fish is expensive, but chicken and thank God most of us do fairly well in these departments.
Okay, thank you so much, Dr. Lang, for your great perspective on the coronavirus, COVID-19. I still don't know why the two different names, but I'm not that smart, so hey.
Well, they're really the same thing. It was the year it was discovered. They say 19. That's what. Yeah, there are other. They call it new corona. There's a lot of people getting common colds over the years. It was corona. So we should hear good news. Seres Tovos for all of us, and Mashiach now.
Thank you so much, Dr. Lang, for your time, and may we only hear good news, and hopefully we could do a little escapia and follow your low, no-carb diet.
Thank you. Take care.